lectures on forensic topics. She has been involved with the mentorship workshops, as well as continuing education for the Colorado Nurse Association. Cris is a veteran, a mentor, an international speaker, and a member of DNA Free. Dr. Finn presents a lively, interactive lecture at Regis University about the do's and don'ts of presenting yourself for a job interview. And tonight she'll share some of his pros with us. Let's give Dr. Finn a wonderful
So don't be intimidated by all that. It really tells you the state has all my money. We have technical difficulty because we can't connect to the projector. So we're going to do it old-fashioned style. It's like the talking head. However, I can be relatively entertaining. I will send you all, if somebody, especially at Bethel, if one of you will email me and say, please send a copy of my PowerPoint, happy to send it to you all. That way you'll have everything. You'll get all those cutesy little pictures.
Why don't we send it there and like speak, and then they can do with what they can do with it.
Absolutely, that's awesome. If somebody will just email me, I'll click it over there. I'm happy to share this. There is absolutely nothing magic about this, other than y'all are getting ready to get jobs. And those of us that are a little darker, white-haired in the room, we've been through some of it, so we may be on the other side of the table. So we're going to kind of look at some of those sorts of things. As you'll see, not having the PowerPoint doesn't bother me a lot, because I'm very fortunate that I've actually lectured internationally a number of times. So when you have rolling blackouts in countries, you know what? Life goes on. So that's what we're going to do. Please feel free, as we're going along, if you have a question, jump in and ask a question. I don't mind being interrupted. We've planned for about an hour, so let me know what's going to help you all. Now, I'm making an assumption, and you all have to help me, that y'all are getting very close to graduating and looking for that first nursing job. Fabulous. So we'll talk about what's currently going on as we look for jobs. You guys are very much aware the economy is not our friend right now. You know, those of us that are a little older, our retirement funds have been a little bit hit. So we've got a lot of us that are still working that would have most likely have retired. So guess what? They're filling that job that you all wanted. We have some of us that are saying, gosh, I gotta work because my spouse no longer has a position right now. So that's kind of working against you. We do know on the horizon that's going to change. There's a nursing shortage coming. Don't get discouraged. What we're actually finding, and I can speak to the Denver market a bit better than Colorado Springs, but it's not that different. Instead of it taking about 3 months for you to get a job and get really nicely placed, it may take up to 6 months. That's okay. You're going to get a job. Okay? Don't let that disturb you. You still have to get through NCLEX, right? So you have some time. You have some reviewing to do. So you'll be just fine. So what are our learning objectives for today? We're going to talk about what are the types. I know I won't hurt on it. What are the types of interviews that are out there? How do you get prepared? We're going to explore some tips that I can give you, both from being an interviewee and an interviewer. So that'll kind of help. Understand the connection between effective communication and landing that first job. Because that's really what you're looking for, is that landing. Then how do you accept the job? You're saying, oh, I just accepted. No, you've got to think through how we accept that. And then we'll look at if you all want to practice a few things. So, what you would see if we had this is a cat fishing in a fish bowl. So you're fishing for that job. I have a sick sense of humor. Sorry. So what the types, there's actually 4 types of interviews I'm going to go over. Behavioral interviews, which are number 1, what most of us are using primarily for our interviewing. Stress interviews, which sometimes you'll see speckled through. technical interviews, and then telephone interviews. Because you interview very different for each of those 4 types. Okay, so we'll get started. Behavioral interviews are a common type that we're using in nursing particularly, or they're also called behavioral event interviews or competency-based interviews. This interview is based on the notion that a job candidate's previous behaviors are the best indicator of the future. So that would suggest what I've done in the past is what I'm likely to do again in the future, given the opportunity. So each of you have lots of clinical experience through your nursing school experiences. So you can say, yes, I've talked to a patient. Yes, I've done. So think through. Hi! So start thinking now before you graduate, what are those patients that I've dealt with? What are those situations that I did really, really well? What's that patient that really stands out in my memory that I felt like when I went home, wow, I really connected. I made a difference in that person's life. So we think about why would that be? So be thinking about those. A behavioral interview, also the interviewer asks you, the candidate, to recall specific instances where you were faced with a set of circumstances, and then how did you personally react? So when you were faced with, I've got to tell his family, because the physician just told them they have a terminal diagnosis, did I run out of the room? How did I help explain that to that person? What did I do to connect? What was that compassion? And y'all are going to hate me, but what nursing theorist guides your practice? I always ask my candidates that. Why do I want to know? Because it tells me something about you and the way you view nursing. Does it matter which one you pick? Not in the least. You may pick Florence Nightingale. Safety, right? Patient safety, reduce infection. You may pick Jean Watson, caring theory. That whole person. And there's a whole gamut that you can pick. So I'm not going to try to tell you all of them, but it's the one that you connect with. So have that on your mind. Who do I incorporate? You will have to demonstrate your knowledge, skills, and abilities for that behavioral interview. And they want to know what is something that's unique about you and how you practice nursing. So rather than merely telling your interviewer what you would do in a situation, well, gosh, if I had a patient that was dehydrated, I'd go and collect the IV supplies, and I'd try to get that IV, and I'd go as low as possible. Really, yeah, we know that. But what would you do? How would you explain it? In the past, when I had to start an IV, I explained it to my patient. I made sure I had all of my equipment. I made sure I didn't contaminate that. I was ready to help that patient. I knew what fluids I had based on their diagnosis. So it's what you did know to help with that. So in a behavioral interview, a typical interview question will be, tell me about a time when you worked with an oncology patient. Tell me about a time when you worked with a patient who'd been in a major car accident.